Hi guys, welcome back to our channel. Today I am talking about health insurance. Today we are enrolling in health insurance. It's annual enrollment time, and I want to talk a little bit about it because the insurance premium for us, it's gone up this year. So I'm wondering, is it the same for everyone else? So for the 2023 next year, our insurance rates are going up. Not by a whole lot. If I kept the same insurance that I have this year, it would go up by about $15. But right now I'm thinking we're going to actually lower our costs. But of course that comes with upping our deductible. I'm curious, what is the lowest deductible through your insurance and what is the highest one? Because with our insurance, the highest deductible is $8,000. So I don't know a whole lot about insurance, but I know some of the basics, and I know that in order for your insurance to actually kick in and start covering things, you have to meet your deductible. This year in 2022, our deductible is $3,000. That's for our entire family. But that, like I said, if we kept that same thing, it would go up about $15, which isn't bad at all. I'm not complaining about that. But there's just some other things that we're wanting to kind of do with our money next year that I would like to adjust that cost in order to have more money in our pocket. If you are someone who has medical insurance available to you, I definitely suggest getting it. Do not go without. If it's something that you can afford, anyone who's been to the emergency room, you know that it only takes a Tylenol in order to get a bill of $700. It doesn't take much. It racks up really quick. So imagine if something would actually happen, like the flu, if you break an arm, anything that could happen that could result in you being in the hospital needing medical care. If you don't have insurance, that bill adds up very quickly. Definitely suggest getting it if you can. Because I just feel like medical debt is some of the worst type of debt that you could get in. You're just trying to get better. If you're sick, you're trying to get well. If you have an injury, you're trying to get that treated. And to be in a ton of debt because of that, I feel like it's not really fair. So if you can get medical insurance, yes, the cost of it can be really high, but it definitely could help you a lot in the long run to have something assist you with your medical costs. So aside from that, like I said, our insurance is going up next year. I'm wondering ultimately why our insurance has to go up. Is it because of the rising cost of medical care in hospitals, like in doctor's offices, things like that going up? We could say inflation, we could blame inflation on it. I feel like a lot of times we are raising the cost of things just because we can, and I don't necessarily feel like it's fair to put that cost back on the consumer. Yes, it's us who has to pay for it ultimately if we need medical care, but I think ultimately when it's something like medical insurance, I'm noticing that it's going up every year. So I feel that there should be more done to lower medical premiums for consumers so we're not out of pocket so much. I think it should be based more off of how much are you using it, because we already have to pay so much out of our medical cost or out of our premiums every paycheck, and a lot of us may not even use it at all. So yes, I do feel like there should be something that could be done to lower the cost rather than having it increase every year. I can't think of a time that it would have just stayed the same. Personally, with my family, in my entire adult life, the only time I can think that I've actually ever reached our deductible was when I gave birth to both of my kids, because the cost of having a birth in a hospital, it's super expensive. So that's probably 2 times that I felt like I fully got my money's worth with insurance. But hey, that's a good thing. I'm not at all complaining about being well, being healthy, and not having to pay a lot of money with medical costs. But that's just the 2 times in my entire life that I can think of that I've actually met my deductible during the year. Another thing with insurance, or with our insurance, Our out-of-pocket maximum, the highest is $8,000. The lowest that I'm seeing is $4,500, and that is the most expensive plan, is the $4,500. Is $8,000 a lot for the deductible? Comment down below and let me know, what is your deductible for your medical insurance, because I've gotten so used to seeing these costs over the years, and I'm wondering, is $8,000 actually a lot for deductible? Now, if it's for car insurance, that's a lot of money. That's a ton. I try to compare it to that just because I'm more familiar with car insurance a little bit. Another good thing that I do love about insurance is that any preventative care that you get is typically covered 100%. So with our vision and dental insurance, that did stay the same, which is super minimal. If you have dental and vision, I'm sure you know it's not a whole lot, and it's just something that you don't have to use as much as medical insurance usually. With your insurance, it's always going to be a gamble because you never know what could end up happening that following year. If you're going to use it a lot or if you're not going to use it at all, you just don't know. So it feels like a gamble. But one thing that a goal of mine for the future someday is to have a savings account specifically for medical costs, and that insurance or that savings account would total the amount of my deductible. So if I, need to use my medical costs for anything, or if I need to have medical care, the money is already there. I'm not there yet to whereas I have just money sitting aside, but that is definitely a goal. Right now we're working on paying off our mortgage. So for sure by the time we're done paying off our mortgage, I definitely want to be able to do that. Just so if anyone has any type of medical costs, it's already there. We don't even have to worry about it. So for the actual cost of insurance for us for 2023, if I were to keep the insurance that we currently have, like I said, it's going up $15. So the cost of that, it would be $190 per paycheck, so about $400 a month. But once a year, they let you do what's called like a health evaluation, where you get your blood drawn and they test you for all these different types of things, and they end up giving you a credit on your insurance. Annually, it comes to $300. Bi-weekly, it comes to about $11. So every dollar counts in my eyes. It does bring the cost down a little bit. So in actuality, if I kept my same insurance, it would be about $360 a month for if we kept the same thing. So with our insurance, obviously it depends on which of the plans you get. There's 4 different options. At this point, we're going to go with the lowest cost option. We're going to do it. And then we'll just have a little bit more wiggle room. The difference between the lowest cost option and the option that I currently have, it is about $60. So we're going to go with that. We do have savings, of course, if anything were to happen and we need to pay extra money towards medical costs. We do have a little bit of savings that we can use if we need to. So right now that I finally made my decision on what I'm going to do, I'm going to make all my selections. We're going to go ahead and get that submitted, and that will be it until next year. So thank you for watching. Please subscribe, and we will see you in our next video.